Hello, everybody. Good evening, and welcome to GH Gospel Radio, and welcome to your favorite show, Let's Talk Marriage. Tonight's topic is one that is really essential, and we've been working on it for a long time now. I know we're going to learn a lot because a stressed person is a difficult person to live with. A stressed person is somebody whose marriage will definitely be in trouble. And like you see tonight, I have two very beautiful ladies with me, and they are not just beautiful, they are very knowledgeable. They are both psychiatry and mental health nurse practitioners. And tonight, I'll let them introduce themselves a little bit. And since they are in the practice of psychiatry and mental health, they are in a better position to explain a lot to us about with stress. And we all know that stress is a major cause of a lot of diseases, especially high blood pressure. And apart from the fact that it affects marriages and puts a lot of strain on families, it can also cause health issues. So tonight we're going to give them all the time to talk to us at length about how to deal with stress. Because you and I know it's the bottom line of our very lives. So I'll start with Mrs. Becky OTENG-MENSAH. I'll let her tell us a little bit about herself, and then we'll continue from there. Miss Becky.
All right. Thank you for having me. And my name is, like you said, Becky Otin Mensa, and I'm from Dallas, Texas. And I work with MB Wellness Associates. Thank you.
Okay, you are very welcome. Thank you for joining us tonight. And we'll go to Mrs. Margaret QUARTEY-PAPAFIO. You all know we've had her here with us. She gave us a very beautiful talk, a very insightful talk about mental health. And tonight, Mrs. QUARTEY-PAPAFIO, please introduce yourself to us again for those who were not here that time.
Yeah, I am Margaret QUARTEY-PAPAFIO. I go by Maggie. That's what everybody calls me. And I also work with MB Wellness, which is located in Dallas, Richardson. Um, and yeah, I'm a psychiatry nurse practitioner.
Mhm. Thank you for making the time to join us this evening. So, without much ado, Mrs. OTENG-MENSAH, can you please tell us all about stress? What is stress and why is it important that we deal with it?
All right. Stress is something that everybody talks about. Everybody mentions it one way or the other almost every day. Oh, I'm stressed, I'm stressed, I'm stressed. Now, what stress actually means is that it's a reaction
Mm,
of like a change in your life, like a
mm,
natural reaction to a change, especially when the change is negative in
mm,
your life.
mm,
Now, it can be anything. It can be losing your job. It
mm,
can be from losing a loved one. It can be marital problems or kids problems. So anything that makes you feel like out of normal, like anything that makes you, somebody will say, oh, I'm so stressed, I'm anxious. Anxiety is part of stress. It's a symptom of stress. We have various things that make you realize that I'm stressed, but in you yourself, you
mm,
know that something is going on in my body. I don't feel right, and there has to be a reason to it.
mm.
So basically, stress is a natural reaction to a change, like our normal routine in life.
Okay, thank you very much. So, Mrs. QUARTEY-PAPAFIO, what do you have to add? What are some of the signs that would show someone that they're dealing with stress?
So, like Ms. Becky said, it's life situations that maybe when you feel overwhelmed with situations, as
Mm-hmm.
in, and you can, when one is stressed, some of the symptoms that you can express, like she said, anxiety, it can come with depression, it can come with other mental illnesses that if it's not taken care of, it will be worse than
Mm,
um, yeah. you taking care of it. The earlier you take care of it, the better. So
Mm.
stress, which everybody goes through it, and sometimes we use it because if not taken care of, it can lead to other mental illness. And like if we're marriage talking, so and most stresses comes with our marriages and things that goes on in our marriage. So if we don't take care of, it can go far
Mhm.
where it affects our mental wellness. So
Mm. All right. Thank you so much. So, Miss Becky, we're Africans, and most of us just live life and we are fine. We don't believe in getting extra help for stress or any other thing. Can you convince us why we need to deal with stress?
Okay. So before I tackle that question, I'm going to add a little bit to what Maggie said. Like
Okay.
she said, the responses can be physical and they can
Mm,
be emotional or mental. Right.
mhm,
And some of the responses include fatigue. You
mm,
get tired all the time. The least thing you are tired. It can be difficulty sleeping or sleeping too much because you are overwhelmed. You want to avoid everything, so your body wants to sleep.
mm,
It can also cause some headaches. I
mm,
mentioned anxiety and depression earlier. It
mm.
can even cause muscle tension. You
Oh.
become so anxious that you have pains behind your neck and your back and like muscle pains because
Mm,
you are tense all the time. You
yeah.
can either gain weight or lose weight because you might have decreased appetite or
Mhm,
increased appetite that will make you eat.
mm,
You can be moody.
mm,
You can be irritable with the least thing. You can be angry. You can even lose focus and concentration. It can cause panic attacks.
mm,
You can have GI problems like diarrhea.
mm,
It can even cause constipation, dizziness, and there's a lot of things that can be reactions to stress. Sometimes you don't know what is going on. Sometimes you'll be like, "Oh, I don't know why I'm just running. I'm going to the toilet, frequenting the toilet all the time." There might be something. You might be stressed about
mm,
certain things.
mhm,
Um, we have to recognize or identify things that are causing us that stress. Like you
mm.
said, as Africans, there are a lot of things that we tend to ignore.
Yes.
Sometimes the stress may be so big that it's so obvious, you know what is causing your stress. But
Okay.
other times, they are so little.
Mm,
Little things are children's behavior. Oh, this is how my child is. When she grows up, she'll be okay, but it's causing you stress
mhm,
indirectly.
mhm,
So the little ones are the ones that can cause, big things in our lives.
mhm,
So as Africans, we should there are various ways that we can adapt
mm,
or modify our lifestyle to the extent that we will be less stressed. Now,
mm,
there are certain stresses that are in your environment, like I mentioned, your child.
mhm,
Maybe it's your husband, like Maggie said, it's in your marriage.
mhm,
You can cut it off.
mhm,
Now, one of the coping skills or the positive ways of managing stress is avoiding it if you can. But things like your children, your marriage, you can avoid.
true.
Things like your job, yes, you
Yeah.
can try and look for another job and
Yeah.
then move away. Maybe your boss is stressing you out, your co-workers are stressing you out, or maybe the skills are becoming so modern that you can cope with it. That can cause you stress. Or maybe the pay is not even enough. That can cause you financial stress.
Mm.
So with that, you can avoid. But when it's your marriage, it's your child, it's a
Yeah, Miss Becky cut off there. I know she'll be back. So, Miss Maggie, can you continue from there? Like, how do
yeah.
you deal
So
with it?
yeah. So like she's saying, when it comes to marriage and when it comes to children with stress, we cannot cut that off.
Mm-hmm.
Um, marriage, the first cure for stress is avoiding that stress. You
Mm.
can avoid some of the stress that comes your way.
Mm.
Um, so something like saying, being able to say no. She's
Mm-hmm.
back.
Mm-hmm. Welcome back, Miss Becky. Yeah, you're talking
Remember?
about how to deal with stress when you kind of.
Becky, do you want to continue? I don't know whether she
Miss
can hear or
Maggie,
not.
keep going. Like when
Yeah.
she, yeah.
So, reducing the stress level, it's one of the ways. Sometimes being able to say no,
Mm-hmm.
even when it's hard to say no, it's one of the ways to reduce stress. Sometimes we take off a lot of loads that you know you cannot do. Um, but you being able to say no to it, and as you say no, I always say, as you say no, you also have to learn to be willing or to be accepting when somebody also tells you a no. um, that's one main reason for you to be able to reduce your stress, because sometimes we have the to-do list, like 100 of them, which we get overwhelmed with, which we cannot attain it, and then the stress, which we're saying, kicks in, the anxiety kicks in, and um, all that. So being able to say no um, will help you reduce the stress in our lives. So it comes to, we're talking about the next day or something, and there are a lot of stuff, like you come from work, your husband wants you to to do stuff in a nice way. You can let them know that, hey, this, can you help with that, or can you contribute with this? So I think Becky is back and she wants to speak, right, Becky?
Her sound is having issues.
Hope you don't go off
Yeah,
again.
yeah,
Oh,
yeah.
thank God.
I'm back.
Okay.
Yeah, Maggie, go ahead. Maggie, go ahead.
Conti- con- yeah, so I'm done actually. Go ahead.
Yeah, so far, you said that to deal with stress, the first main thing is if you can avoid it, avoid it. But like you mentioned, not everything is avoidable. Like if you're having stress from your marriage or from your children, you can't just avoid it. You sort of have to work through it. And Miss Maggie also added that sometimes you have to reduce the stress to be able to cope better with it. So that's where we are at right now. Do you have any other things to add to how you can deal with stress or reduce stress or avoid it?
All right. So, like Maggie said, you first of all you have to identify your stresses
Mm-hmm.
and avoid them.
Mm,
There are some that you can't avoid. Like I said, your child has a problem, like a behavior problem. That's a
mm-hmm.
problem in your marriage. There's a problem with, or even with job. You can go ahead and find a job, but the
Mm-hmm.
ones that you cannot avoid, you
Mm-hmm.
have to find some coping mechanisms,
Yeah.
to be able to deal with them,
Mm-hmm.
like with your child. So first of all, you have to identify your triggers.
Okay.
Okay, you have to identify your triggers. And then also, when you identify your triggers, and like we said, if it's about your child, um, your child, you know who your child is. So maybe giving yourself some me time sometimes from home
Mm.
helps with
Yeah.
that.
Yeah.
Also, um, you have to change the way you respond to some of the stresses.
Mm.
Okay. Let's say our stress is at home. It's from marriage. Okay,
Okay.
your husband is giving you stress. Maybe you have your mom, your mother-in-law, in the house. Maybe you have a child that's giving you stress, always having problems at school and things like that. Things like that you cannot avoid, but
Yeah.
things like jobs, you can change your job.
Yeah.
Things like your friends, you can change your friends. Things like maybe your church, that there are particular things that are going on in the church that can cause stress, that's causing you stress, that you can change your stress.
Mm.
So with the ones that you don't you can't avoid, you have to find some coping mechanisms. Okay,
Yeah.
like with your child or with home. If it's in the home, you can find a me time for yourself. Okay, like there are days that you be like, let's say Wednesday,
Mm-hmm.
um, Wednesdays from 1 to 5 or
Mm-hmm.
1 to 4. It's time. It's a me time
Okay.
to relax
Mm.
yourself. If the problem is coming from your home, most of the time our stresses come from the home. With
Mm.
the outside stresses, we can find means to avoid them,
Yeah.
but the most difficult ones are the ones that that's it's within the home,
Yeah.
husbands, children, and things like that. Okay,
Yeah.
so there are days that you can, let's say Wednesday from
Mm-hmm.
1 to 4 is
Mm-hmm.
my me time. Is the
Mm-hmm.
time that you distress yourself. It's the
Mm.
time that you move away from everything that has to do with the family, everything that is causing you stress.
Mm-hmm.
You can go out with your friends.
Mm-hmm.
I have a colleague that said she doesn't go out, but
Mm.
she goes to her bedroom, closes the door, tell her kids that this is mommy's me time. And for
Mm.
4 hours, she stays in her room and does things she likes, like reading, watching movie, sometimes sleeping, just to relax and distress yourself.
Mm-hmm.
The things that you can avoid, yes, go ahead and avoid them. If you have to change your job because
Mm-hmm.
of that, yes.
Mm-hmm.
If it's possible, somebody would say that it's easier said than done.
Mm-hmm.
Yeah, if it's possible, yes, change your job. All right. Another thing you can do also is like breathing exercises.
Okay.
You can do breathing exercises. Some people like physical exercises. Yes, that can be you. You create a me time for yourself to
Mm.
distress yourself.
Mm.
So some people like meditation. Some people like yoga. Some people like stretching. Some people even like hot shower
Mm. Huh.
when they are stressed. Yeah. So you can just take hot shower, shower, the heat opens your pores, so it relaxes you.
Ah.
Yeah, these are some of the little things you can do. You can also do deep breathing exercises
Mm.
as well, right? And a healthy diet. Healthy diet makes you feel less stressed.
Mm-hmm.
There's this hormone called cortisol.
Yes.
The higher the level in your system, the more stressed or easily stressed you become. So
Mm.
if you eat healthy diet, especially the plant-based diet,
Mm-hmm.
it reduces the cortisol level. So you if you are encountered with anything, any difficulty, you are able to manage it well without feeling more stressed.
Mm-hmm.
Good sleep.
Yep. Especially for new
Good
mothers, right?
good sleep is very, very important. Okay.
Yes. Yeah.
Um, like we all know, when you wake up and you are fully rested, you are energized, you feel
Yes.
happy in yourself, you are able to think well, you are able to solve problems well without
Mm-hmm.
being overwhelmed. Because if you're not able to solve problems, we have problems being thrown at us left and right every day.
Yeah.
Okay, so when you wake up in the morning, it's problem, problem, problem. So you should be able to solve your kids' problems, solve your husband's problem, solve your job problem, solve your own problems as well. Especially women. Women have a lot on our plate.
Yeah.
Right. So if you wake up well rested, you're able to think, and you're even happy in yourself. So even if somebody's telling you something or bringing a problem, you have that patience to listen through what the request or the problem is, so you can solve it. So it's very like I said, sleep is very important. Healthy diet is also very, very, very important.
Okay.
Exercising. Exercising is one of them. Exercising is also very important. And also creating a me time, like I mentioned earlier, create a me time for yourself. That is important. Whatever it is, just let it wait and create that me time for yourself so you can rest. And then when you come back from your me time hibernation, as somebody would say, you come refreshed, happy in yourself. You've done something that has made you happy and refreshed. So whatever the problem is, you can solve it, or you can attack it without feeling stressed.
Wow, that's great. Yeah, so Auntie Vivian, I see you. You're welcome. And if you just joined us, we are talking about dealing with stress. And we have here Mrs. Becky OTENG-MENSAH. She's been talking to us with her partner, Mrs. Margaret QUARTEY-PAPAFIO. She fell off. She'll be right back, I know. And so far, we said that it's important to deal with stress, because if we don't, there are all sorts of repercussions that Miss Becky will tell us a lot more later. But so far, she said that the best way to deal with stress is to avoid it. If you can avoid it, just avoid it and move on. But if you cannot avoid it, especially pertaining to family, like husband, children, if the stress is coming from that angle, you cannot avoid it. You just have to find ways to reduce it or minimize it so that you're able to cope. And then she talked about some of the things we can do to help us deal with the stress: healthy diet, exercise, good sleep, me time, and then also doing pleasurable activities within your me time, whatever works for you, if it's exercising. And then she also mentioned breathing. You can look more into breathing exercises, because breathing has been found to be one of the really great ways to manage your stress. So these are the normal healthy ways for dealing with stress. So let me ask you, Miss Becky, what happens? What if somebody is not able to manage their stress and it gets out of hand? How will they know that their stress have gotten out of hand so that they can seek help?
All right. So if the stress is to the extent that it's affecting your normal daily life, your normal activity, like it's affecting your ability to go to work, it's affecting your ability to maintain your home, ability to take care of your children, your marriage, and even taking care of yourself, like your person. Then it's about time. If it's affecting your sleep, then it's about time to talk to somebody.
Okay. So who do you talk to? How do you seek that help?
It depends on the extent of the stress. Now, some of us, we have people that trust their pastors, they trust their pastors' wives, they trust the elders of the pastors, elders in their churches and things like that. Sometimes it's not like it's a whole medical thing that needs some diagnosis. Sometimes you just need a few sentences of encouragement, a few words. Okay, so if you go to church and you have a trusted person, you have a trusted person in your church, You can
Mm,
talk to that person. It could be your pastor. It could be your mommy. It could be your women's leader. It could be anybody
mm,
that you feel like this person is trusted. If I tell them my problem, that's where it stays. It doesn't go anywhere.
mm.
Because going to tell somebody you don't really know can go, move from one place to the other, and then what
Trusted.
comes after it makes you feel more stressed and makes your situation worse. So
Yeah.
find a trusted person.
Mm,
Sometimes you need just one word of encouragement, and that's it.
yeah. Yeah.
You can also find like a trusted friend.
Mm-hmm.
Talk to a trusted friend about it. If you feel like, no, I don't trust anybody, I don't know, you can talk to a therapist.
Okay.
There are a lot of therapists online. There are a lot of counselors online.
Mm,
That's one issue that we're talking about the same topic, and somebody said, "What if I don't trust anybody in my church? What if um,
okay.
my soft mommy or the pastor would take it somewhere else and
Well,
things like that?"
yeah.
You can find a therapist. Okay,
Yes.
you can find a talk therapist, and talk to that therapist. Stress can get worse to the extent that it can cause suicidal ideations.
Wow.
Yes, it can. It can develop into depression, develop into anxiety, and it can cause suicidal ideations as well.
Mm-hmm.
So if you think that you're talking to somebody, like a trusted person, is not working, yes, go and see a doctor
Yeah.
and talk to a doctor. Maybe at that point you need medication.
Mm. Okay, so for somebody like me, if I want to find a therapist, are you saying it's okay for me to just go online and Google therapist and then just pick one from there? What's the best way to find a therapist or a doctor? Yeah, we're asking about, yeah, you're back. Yeah, and I think that the sound is, did you unmute your mic? Yeah, because we can hear you. No, not still can hear you. Yes, Miss Becky's line went off, but I know she's going to come back. So far, we're talking about, hey, Mami Nikwe, you're welcome. Let the questions flow. Yeah, so far, we are talking about dealing with stress. And we're having Mrs. Becky OTENG-MENSAH and Mrs. Margaret QUARTEY-PAPAFIO. They're both psychiatry and mental health nurse practitioners. They are in the field. They're dealing with a lot of people, so they have cutting edge advice. And so far, we said that stress, it's a leading cause of so many disorders, and it's important that we deal with stress. And the easiest way to deal with stress is to avoid it, but sometimes it's unavoidable, especially the ones that occur from the side of family and children. So if your stressors are from your family, it's better that you are able to identify it and be able to find what your triggers are so that you can minimize it or reduce it. And Miss Becky is back. Yes, Miss Becky was talking to us about how to deal with stress after it has gotten out of hand. And she was talking about the fact that you need to find therapist or a doctor to help you at that point. And she said that if you find that you are not able to perform your normal life, as in you're not being able to go to work, normally like you used to. You're not being able to take care of yourself. You're not being able to be functional in your marriage. You're not being able to take care of your children. That is a point that you seek help. And that is not always that you have to get medical help. You can talk to a trusted person. If you trust your pastor, go talk to him. If you trust your pastor's wife, if you have a good friend, because you don't want to add more stress by trusting the wrong person. It could come back and cause you more stress. So now she's talking about the health aspect, the medical aspect of it, finding a therapist or finding a doctor. How do you go about it? Do you just Google, or what is the best way to do it?
All right. So most of us have like a PCP.
Okay.
Yeah, most of us have primary care provider. Right?
Okay.
So if you don't have a primary care provider, you can just walk into any clinic.
Hmm.
Just walk into any clinic and talk to them about it. But
Hmm.
if you have a primary care provider, you can start with that provider. And
Hmm.
most of them deal with can treat stress, or even you can go to the ER.
Hmm.
Yeah, you can walk into the ER and talk to them about what is going on, and
Hmm.
then they can help you with that. And even after seeing the ER provider, they will maybe refer you to someone in your area, that
Hmm.
a doctor in your area that can help you with that as well.
Hmm. Yeah, I know that you personally have mental health services that you offer. Can you tell us a little bit more about the services that you offer and how people can contact you if they need you?
All right. So, Maggie, my partner, and I are psychiatric mental health nurse practitioners.
Mhm,
And our clinic is MB Wellness Associates,
mhm,
located at 1651 um, North Collins Boulevard. And our number 972-951-0698. Now, we deal with depression, anxiety, almost all the psychiatric mental health disorders, except autism. Even with autism, when you're already diagnosed, we can manage it.
mhm,
We do diagnosis, we do medication management, we do referrals to therapy and things like that.
mhm.
So
Okay.
in case somebody is stressed, somebody has depression, somebody has anxiety, um, bipolar disorder, schizophrenia, um, almost all the mental disorders except autism. Yeah, you can contact us and we can help you with that.
Okay. I'm just curious about autism. How come autism is not included in your practice? I'm just curious.
Yes, yes. Um, we are psychiatric mental health nurse practitioners, and it's not in our expertise
Okay.
to diagnose autism,
Okay.
but we have some autistic patients that need medication management for other things like depression, anxiety, behavior issues, and things
Mm,
like that. So we do manage those things.
okay. All right. That satisfies my curiosity very much. Okay, so let's say maybe your partner or your child or your friend, somebody else apart from yourself, is going through stress and they are at a breaking point. Hello, Sister Elsie. So nice to have you. Welcome. What if you have somebody in your life, somebody very close to you that you may even be responsible for, like your partner, your best friend, or your child, and you realize that they're going through stress? And they may even say that I'm tired of this life or something like that. How should you handle somebody like that?
Yeah, it depends on what is going on. Okay.
Mhm,
We have our teenagers, people who like talking, I'm tired of this, everything, I'm tired. So you have to be very observant whether the
Okay.
person is serious, whether it's new, whether it's something that, it's one of those things that this person says all the time.
Mm,
You have to make sure that you identify whether it's serious or not.
okay.
Some of our kids, I give up, and things like that,
Mhm,
because you ask them maybe to wash dishes, or you ask them to go and sleep, early. So they and things like that. So we don't, you don't really take it serious. But even with that, you have to be observant, because
mm,
it's possible that it might come to a point that what they are saying is true.
mm, mhm,
Right. So when you see somebody, especially if it's new and it's significant, you start asking questions.
mm,
You
mm,
start observing that person.
mm,
What's going on? How do you feel? What do you think? What do you want to do? And
mm,
if you feel that the person or the child feels suicidal,
mhm,
just take the child to the hospital. Don't
mm,
leave, don't leave that person alone. It could be even an adult.
mhm,
Don't leave that person alone. Keep watching, observing, asking questions, and if it's possible to take that person to the ER, do that immediately to prevent anything that we don't want.
mhm. And talk to us about suicidal let me take this question. My boss says, can stress lead to high blood pressure? Miss Becky, I'll let you answer that.
Yeah, stress can lead to high blood pressure. Yeah, stress can lead to high blood pressure, especially if you are not getting good rest, you're not getting good sleep. Yes,
Mm,
your blood pressure can be high. So if you feel like you feel so stressed, and you check your blood pressure at home, if you feel like my blood pressure, I think my blood pressure is high, you can go to Walmart, go to these stores, get an equipment, or go to an urgent care to check your blood pressure and see
mm,
what is going on, and see a doctor if
mm.
it's necessary.
Correct. Great. Yeah, and Mrs. Nikoi says, how do you help someone that is going through stress and depression and is in denial? They don't want to admit it. How do you deal with it?
It depends. I'll say that it depends. In denial, there's a saying that obi entimi enumedro emma obi
Yeah, for yes.
emma yarefo. Right.
Mm-hmm.
So um it's very difficult if the person doesn't accept it, because
Mm-hmm.
healing starts with acceptance,
Mm-hmm.
acknowledging that this is what is going on.
Mm-hmm.
So all I can say at this point is that we have to keep an eye on that person.
Okay.
Just keep an eye on that person, and maybe they don't recognize it, but um, identify
Mm-hmm.
anything you see that depicts or shows depression. Tell the person that these are signs of depression. This and this and this you're saying. This and this you're doing. It's a sign of depression. And yeah, say I'm going to speak tree. It means that nobody takes medication for someone else.
Uh-huh.
I won't say the tree. Let me say it in English, because I don't know who is on here. You don't take
Mm,
medication for someone else,
yeah.
especially if they're grown-ups and they are not ready to see a doctor. They are not ready to open up and talk about, or even recognize
Yeah,
that
they
they are
haven't
depressed.
too.
You
Mm,
just have to keep an eye on that person.
mm,
Let's just keep an eye on that person and try to identify the depressive behaviors or
uh-huh.
just behaviors that they
Mm-hmm.
have, to let
Mm-hmm.
them think about it, and make at the point they'll be like, hmm, yeah, it's true, yeah, it's true. And then they might be willing they might be willing to go with you to maybe see a doctor, or maybe a counselor. It doesn't have to be medication.
Mm-hmm.
It doesn't have to be medication. Maybe a counselor.
Mm-hmm.
Even in our churches, we have um, males and females that are counselors in churches. If the
Yes.
person doesn't want to see a doctor or a professional counselor, yeah, they
Mm-hmm.
can see a counselor at church.
All right. Thank you so much. And my boss says, can stress lead to hair loss?
Yes. So yes, stress can lead to hair loss. Yeah, that's
Okay. This man here laughing, Dr. Bote, he's bald. And baldness is hair loss. So is baldness the same as hair loss from stress?
no. I think they are two different things.
Mm-hmm.
Yeah. Baldness is like an aging process,
Mm-hmm. And then
and
they're 40, so and these days even 35 year
even
old.
35, yeah, 30, 35 start. I have a relative that is about 32, but he's getting bald now. He's got that round thing on top of his head.
Yeah.
So I think it doesn't matter the age.
Yeah.
Now it doesn't really matter the age. So yeah, so stress can cause baldness.
Mm-hmm.
Yeah, stress can cause baldness, and age can do that too.
Okay.
So
It's not all the
if
hair
you feel
loss
you're
that's due to
stressed,
stress. Mm-hmm.
sorry, if you
So
feel
you're
you're
saying that it's not all the hair loss that's due to stress. Some of it is just natural,
not
inherited. and-
exactly, and some can be caused by diseases.
Mhm,
We have diseases that can make you lose your hair. But
mhm,
if you feel like none of these come to play and you are still, getting bald and you feel stressed in yourself, go
mhm.
ahead and see a doctor about it.
At least to be sure, right?
To figure what is going on. Yes.
Okay. Okay. Yes. And Mami Nikwe says, is stress an abnormal diagnosis?
Stress is not an abnormal diagnosis.
Okay.
Stress is a normal reaction to a
Mm-hmm.
change in our life.
Mm-hmm.
Okay? It can be every day, it can be about anything.
Mm-hmm.
But if it's lingering on
Mm-hmm.
and it's turning into something else, it's getting worse and worse, then
Mm-hmm.
it becomes a diagnosis.
Mm-hmm.
So
Okay.
that is where you get your depression and you get your anxiety and all that coming from.
Okay. And Society says, can someone be stressed without knowing it?
Stress is a natural reaction.
Mm-hmm.
It's a natural reaction to a change. So you
Mm,
will know.
mm,
You will know unless you are ignoring it.
mm.
Unless you are ignoring.
So for it to be stressed, you have to know there's some extra pressure on you.
There's some
It's true
extra.
that sometimes you may not
Some,
know the cause, but for
exactly.
sure you will feel that there's pressure.
Exactly.
Okay.
Exactly.
No, not knowing the cause does not mean you don't know you're stressed. You do know, just that you don't know why.
You are not recognizing it.
Yeah. Okay. So let me use this opportunity to ask about suicidal ideation. As Africans, a lot of times when somebody attempts suicide, most people will say that this person is foolish. They are very selfish. Why would they want to kill themselves? There's nothing wrong with them. They can even identify their lifestyle and say that you have everything you need. I remember I saw one post in the newspaper. There was this gentleman who had hanged himself, and the picture that they put in the papers, he was hanging on top of this nice, beautiful bed. And somebody made a comment that, look at the bed you're sleeping on. Why would you kill yourself? So, can you talk to us a little bit about suicide? Suicidal ideation and why people sometimes commit suicide, because for us Africans, we don't see why and we don't see how. But can you explain a little bit about that?
All right. So suicidal ideation, it's the thoughts of giving up, giving up in life.
Mm-hmm.
Now, and it usually would start with like stress, like the natural stress
Mm-hmm.
that we just mentioned, like our day-to-day stresses. it could be money, it could be marital, it could be your children, it could be a job, it could be anything.
Mm-hmm.
Right. So then if it's not resolved,
Mm-hmm.
it turns into depression.
Mm-hmm.
You get depressed. And you can get depressed to the point that you don't want to do anything. You don't want to take a shower. You don't want to brush your teeth. You don't want to talk to anybody. You feel tired all the time. You are sleeping all the time. You are not happy in yourself.
Mm-hmm.
Don't take care. You won't even go to work. You even clean your house. You even take care of your children or your marriage.
Mm-hmm.
At that point, the suicidal ideation can set in.
Mm-hmm.
Suicidal ideation is a symptom of depression. That's a serious symptom of depression.
Mm-hmm.
Now, let's say you want something in life, you're not getting it, whatever it is, whether it's marriage, whether it's children, whether it's job, whatever it is. Now,
Mm-hmm.
you can get so depressed that you want to give up. That is where the suicidal ideations come in. Right. So when the suicidal ideations come in, you just give up. You don't want to do anything. You don't even want to see friends.
Mm-hmm.
And if you become suicide, some people have just suicidal thoughts. They
Okay.
just think about it. Um, um, we have these teenagers. I give up. They just say it just like that. I
Mm-hmm.
give up. I give up. That doesn't mean that they actually have suicidal ideation. They say, I give up.
Mm-hmm.
But if you see that somebody is so depressed that they don't want to talk to people, they
Mm-hmm.
are giving out their belongings, like the
Mm-hmm.
valuable belongings,
Mm-hmm.
something that you be like, this thing, this person doesn't leave it at all. He won't even let you hold it. But one day he comes to give it to you. Yes, that take it. So watch that person. That he or she may be having suicidal ideations.
Mm-hmm.
Okay, and if you see things like that, they are giving up in life because they are so depressed that they just want to either kill themselves or die or things like that. When you have a family member with suicidal ideations, or you see somebody, our teenagers, especially when they don't want to wash dishes, they don't want to do things, they don't want to clean their rooms, they feign things like that. That doesn't mean that they are suicidal. It's just
Mm-hmm.
a way of
Being a
getting
teenager.
certain things. But
Yeah.
that doesn't mean that don't watch them. Watch them.
Mm.
Some
Watch.
may be really suicidal. There are a
Mm.
lot of things that are going on online. They are
Mm.
being bullied. They
Mm.
are being threatened and things like that. So
Mm.
although they won't open their mouth to tell you, they may be suicidal.
Mm.
So just watch them.
Mm.
So if you see somebody, especially with the teenagers,
Mm-hmm.
you see that they start cutting themselves.
Mm.
We have, if you have a child at home
Mm-hmm.
that is always wearing long sleeves, even if it's hot,
Mm-hmm.
roll up the sleeve and see what is going on.
Okay.
Because some of these kids are just cutting themselves, hurting themselves, silently because they are suicidal.
Mm.
So if you have a child like that,
Mm-hmm.
please take the child to the emergency, or if you've got a primary care physician,
Mm-hmm.
or find a therapist for that.
Okay.
Okay.
Mm.
So suicidal ideations can lead to a lot of things.
Mm.
Some people will verbalize it, some people
Mm-hmm.
would not.
Mm.
And some people will just verbalize it like our kids, our teenagers. Oh, I give up. I give up. I give up.
Mm-hmm.
Things like that. You have to watch your child.
Mm.
Suicidal ideation is um, um, like prevalent among our teenagers
Mm.
because sometimes they are being bullied online. This time it's all online. Everything is all online.
Mm.
So they are being bullied silently. They are being bullied at school, or things are going on. So let's just watch them. Roll
Mm-hmm.
their sleeves.
Mm-hmm.
roll their sleeves and see what is going on. Also talk to your kids.
Mm.
With adults they might say something for you to know, like
Mm.
they won't come to work.
Uh-huh.
They'll be feeling sad all the time. They'll be staying in their rooms. They'll be avoiding people. They are grown-ups. With that, it's if you're not very close to them, it's difficult to catch. But our children, if
Uh-huh.
their behavior changes, just
Uh-huh.
watch them,
Uh-huh.
especially teenagers.
Uh-huh.
Now, if you find if any of your family members is suicidal, please, 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 please take that person to the hospital,
Uh-huh.
because you may not know what can happen tomorrow.
Uh-huh.
Um, you can even call 911 if you
Yeah.
think something that they are actively cutting themselves, or swallowing medications, or doing things. You just call 911
Uh-huh.
immediately for them to get help.
Uh-huh. Oh, thank you very much. That was so insightful. And Auntie Vivian had a question. He said, if you are tired and you can't sleep, does that mean you are stressed? If you can't sleep at night repeatedly, you can't sleep at night, is that a sign that you're stressed?
It
Even
could
though you're
be. I
tired.
would say I would say yes or no.
Mm-hmm.
There might be something going on in your body
Mm.
that you need to see a doctor
Okay.
about it. Yeah.
Okay.
So if you are tired but you can't sleep, you continue to be tired. Yes, it could be stress.
Mm-hmm.
If you are stressed and you can't sleep, yes, you can talk to a doctor about it. It could
Mm.
be something going on like physically, but not actually stress.
Mm.
So there are a lot of things that come into play
Mm.
um, if you are not able to sleep.
Okay.
All those stress can cause that.
Mm. So you shouldn't just put it to stress. You should just try see your doctor, get checked out first, and then
Check out
see.
stress and make sure it's stress before you tackle stress. It could be anything.
Okay. My mini question says, besides pharmacological means, what other way can depression or what is SI? Is this suicidal ideation? I'm guessing be treated. I know people on meds but still experiencing the symptoms. Miss Becky, what do you have to say to that?
They can go to therapy. There's
Mm-hmm.
also counseling.
Mm-hmm.
There's also sometimes the cause, or what is causing your depression
Mm-hmm.
is in your home.
Mm.
It could be in your marriage, it could be among your kids, it could be anything, your job.
Mm.
It's something that is ongoing. If it's
Mm.
something that is ongoing in your environment, medication can't help much.
Yes.
You need to learn coping strategies.
Mm.
That is where that is why you need to see a therapist
Okay.
to help you with that. Medication can take you so far in those situations.
Mm-hmm.
You should also be able to learn how to manage
Mm.
them yourself.
Mm. 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 Wow, I didn't even realize our time was almost up. My boss says, is it possible to live a good life in America without stress? Boss, are you stressed out?
This is a hard one.
Yeah.
Stress, I would say, from based on my experience, is natural.
Mm.
Okay, but if it's lingering on and it's having a negative effect in your life, then that turns into something else. That
Okay.
turns into um, um, certain diagnosis, depression, anxiety, whatever.
Yeah.
All
So
right.
what you're saying
So,
is, oh, sorry, go ahead.
so in America, I would say that, to me, based on my experience in America, um, you can live a reduced stress life. I won't say stress free, because
Mm-hmm.
you don't know what's going to happen tomorrow.
Mm.
So I can't say that stress free. We have kids, we have family, we have. If maybe it was just our lives, then maybe we can control it to some extent.
Mm-hmm. Mm-hmm.
But we are dealing with people. We are dealing with our kids, marriages, and things outside. So there will be some stresses here and there. But
Mhm.
it's the way you handle it that
Yeah.
determines if it will turn into a diagnosis or not.
Mm, mm, mm. That is spot on. And we've had such a great time that I didn't see how the time went. We are at the end of the show. But I'd like to ask you, Miss Maggie is asking, how do we deal with stress in our marriage? I think we would have to tackle that in a whole. Miss Becky, do you have anything to say to that?
How to deal with stress in our marriage.
Yeah,
Marriage is it's a different ball game.
true.
It's a different ball game. You are dealing with somebody entirely from another upbringing.
Mm,
Okay. And you're also coming from, it could be east and west,
mm-hmm,
you know, different.
mm.
Okay. It's all about compromise.
Compromise.
It's all about meeting each other halfway.
Mm, mm.
Maybe we'll do details the next time.
I know, because marriage is a big playground on its own. So hopefully we'll be able to get you another time to come talk to us about stress in our marriage, how to deal with stress specifically in marriage. But I know that most of us have learned a lot, because I personally have learned so much, because some of the things you think that you know, but when you hear the perspectives, you know that, oh, there are a lot of things you could be doing. So at this juncture, I would like to say a big thank you to you, Mrs. Becky OTENG-MENSAH, and your partner, Mrs. Margaret QUARTEY-PAPAFIO. She was on earlier, but due to technical challenges, she fell off. Thank you so much for making the time to share your valuable knowledge with us. We hope that next time when we call on you, you would still welcome our invitation and come share some more with us. And they have a wellness. Did you say M and J?
MB Wellness Associate.
MB Wellness Associate. If you need help, just contact them. She dropped her number earlier. We will put it in the notes sometime. So if you need any help, you can pick her number, call her, talk to her, and get all the psychiatry or mental health services that you need. So this is where we end our program tonight. Thank you so much for joining. Thank you for your questions. And anytime you're watching this program, if you have any questions, go ahead and type it in the comments and we will get to it. And until we come your way, hopefully next week, same time, may God bless your marriage. And don't forget that it takes a good Christian to have a good Christian marriage. Bye-bye.
Thank you.